Hello and welcome. Today we're going to crack the code on one of the most powerful tools in critical care, the arterial blood gas, or ABG. Now I know it sounds a little intimidating, but trust me, by the end of this, you'll have the keys to unlock exactly what it's telling you.
So here's the big question, right? How can this one little blood test give us such a massive insight into what's happening with a patient? It might seem like magic, but really, it's just pure physiology, and we are going to break it all down together step by step.
You see, an ABG gives us this crystal clear snapshot of three absolutely critical body functions. First up is gas exchange. Basically, how well are the lungs doing their job of getting oxygen in and carbon dioxide out? Then there's ventilatory control. Is the patient's breathing actually effective? And finally, we have acid-base balance, that delicate chemical tightrope that literally every single cell in our body needs to survive.
Okay, let's dive right in. What exactly is an arterial blood gas analysis anyway?
Well, an ABG is a blood test, but it's taken from an artery, not a vein. That's super important. It's a total staple in the ER and ICU because it gives us a direct measurement of what's going on, right from the source. It's absolutely essential for keeping an eye on patients with things like respiratory failure or serious metabolic issues like diabetic ketoacidosis.
All right, so to really understand ABGs, you have to meet the three main characters in our little story of acid-base balance. Get to know these three, and I promise you are already halfway there.
First up, we have pH. Think of pH as the ultimate judge of balance in the body. It's all about measuring acidity or alkalinity. And just look at that normal range, 7.35 to 7.45. It is incredibly narrow, and that's because all our body's enzymes and functions can only work properly inside this tiny little window. If it shifts too much, it can become life-threatening fast.
Next on the scene is HCO₃, which is just the partial pressure of carbon dioxide. This is our respiratory player. Now, here's a key tip. For our purposes, just think of CO2 as an acid. Why? Because when it mixes with water in your blood, it forms an acid. And since we get rid of CO2 by breathing, its level is controlled completely by the lungs. The faster you breathe, the more you blow off, and the lower your CO2 gets. It's a direct relationship.
And player number 3 is HCO₃, or bicarbonate. This is our metabolic component. Bicarbonate is a base, an alkali, and its main job is to act like a sponge, soaking up any excess acid. Now, unlike CO2, which is all about the lungs, bicarbonate levels are managed primarily by the kidneys.
So, we've got our three players: pH, the respiratory acid CO2, and the metabolic base bicarbonate. Now let's get to the really cool part, seeing how they all work together. Their relationship is simple, it's predictable, and it's the absolute key to interpreting any ABG.
Okay, the first rule you need to lock in your memory is what I call the seesaw rule. The relationship between pH and CO2 is just like a seesaw. Remember how CO2 is an acid? Well, because of that, when CO2 levels go up, the pH has to go down, making the blood more acidic. And if CO2 goes down, pH goes up. They always move in opposite directions.
And our second rule? It's even simpler. This one is the elevator rule. The relationship between pH and bicarbonate is like they're riding in an elevator together. Since bicarbonate is a base, when its level goes up, the pH also goes up, making the blood more alkaline. If bicarbonate goes down, pH goes right down with it. They always move in the same direction.
So that's how it's supposed to work. But when the lungs or the kidneys, our two big buffering systems, can't keep up, that delicate pH balance gets thrown way off. This creates one of 4 primary acid-base imbalances, and an ABG can spot them instantly.
And this is where our two rules really pay off. Look at this. If the lungs aren't working well and PaCO2 starts to build up, what happens? Our seesaw tips, right? And the pH goes down. Boom, that's respiratory acidosis. On the flip side, if someone is hyperventilating and their PaCO2 drops, the pH goes up, causing respiratory alkalosis. The exact same logic works for our elevator rule with metabolic issues. See, it's a really clear and predictable system.
All right, you've met the players, you know the rules of the game. Now let's put it all together into a simple four-step process you can use to interpret any basic ABG result every single time.
Here it is, your four-step method. Step 1. First thing you do always is look at the pH. Is it low, meaning acidosis, or is it high, meaning alkalosis? That's your main problem. Step 2. Now check the PaCO2. Is it moving in the opposite direction of the pH? Does it follow the seesaw rule? If it does, you found your respiratory cause. Step 3. Now look at the bicarbonate. Is it moving in the same direction as the pH, following the elevator rule? If yes, that's your metabolic cause. And finally, step 4, just pinpoint the primary disorder. Whichever one, respiratory or metabolic, explains that initial pH change is the root of the problem. Simple as that.
And, this is why it all matters so much. This isn't just some academic exercise. Being able to recognize these imbalances quickly and accurately lets clinicians step in and do what needs to be done. It's a skill that literally turns numbers on a page into life-saving action.
So there you have it. You've learned the key players, you know the rules they follow, and you've got the steps to interpret their story. You now have the foundation to understand the language of ABGs. The only question left is, what will you be listening for? Thanks for joining me.